really are going to watch this story now, because if you think that the biggest nightmare at the dentist's office is the drill, you may very well change your mind tonight. Have you ever given a thought to the water that's sprayed in your mouth? You assume that it's clean and safe. But we did some checking and some testing, and what Arnold Diaz found is enough to make you sick.
For most of us, it's hard enough just to go to the dentist. But would you believe the water your dentist squirts in your mouth, uses in the drill, or to clean your teeth may be loaded with bacteria? Some of it potentially dangerous, some of it from the saliva of other patients. In fact, the water coming from these dental tools may well have more bacteria than the water in a public toilet. Our 2020 investigation turned up dental water, often so slimy, so dirty, it's been compared to pond scum.
Sometimes we get very large entire pieces coming out of the line.
That came out of a dental line?
That's correct.
That is disgusting.
That is disgusting.
The water in these lines patients need to be concerned about because it's not even of drinking water quality.
Most patients don't know that, but the American Dental Association certainly does.
The ADA decades ago took the stance to improve the quality of water coming out of the dental unit water lines.
The ADA set a goal to clean up dental water by the year 2000, and dental journals advertise products to rid the water of that slimy, unsanitary biofilm. Yet most dentists are still squirting bacteria-filled water into their patients' mouths, says San Francisco periodontist Dr. George Marajan, who has studied and written about the problem.
You've got to wonder, why are we still doing this? Why do we have 19th century contamination risks as we enter into the 21st century?
Why is dental water often loaded with bacteria? The problem is the design of the water lines that feed the dental tools.
This is what the patient typically sees, but this is what's underneath it all. This is the tubing that we're talking about.
When the instruments are not in use, the water sits inside all that tubing and stagnates. The small number of bacteria that are naturally found in the water rapidly multiply and cling to the walls of the tubing until it's time for your appointment.
And in goes the flushing of some thousands and thousands of bacteria. There's something wrong with that.
We were amazed to find how widespread the problem is. We had Professor Robert Statt, a microbiologist with the University of Louisville Dental School, test water samples from more than 60 dental offices in Atlanta, Louisville, Washington, New York, and San Francisco. The samples were each put in a petri dish, and with the aid of a high-powered microscope, Statt counted the number of bacteria colonies that formed. He found an incredibly high number.
How does the level of bacteria you found compare to the standard set for drinking water?
It's thousands of times higher.
Thousands of times higher?
From most offices, yes, sir.
Almost 90% of our samples had far more bacteria than the 500 colonies or less allowed under federal drinking water standards. Astonishingly, more than half had bacteria counts above 50,000, and several were more than 1 million.
From an aesthetic standpoint, just the gross numbers of organisms that we found is really, to me, unacceptable.
2/3 of the samples contained oral bacteria. That comes from the saliva of previous patients that gets sucked back into the water lines.
Someone has said it's like sharing spit.
It probably is no different than at the restaurant having a bite of someone else's dinner because it tasted so good.
But then you could choose whose dinner you wanted to bite.
That's correct. This is the men's room.
And yes, we compared the water from a number of dentist offices with water from their toilets.
And we just came in here, took a toilet, came down.
You took it right out of the toilet bowl?
Yes.
In nearly every case, the water from the toilets was cleaner than the water going into the patient's mouths. Gross, yes, but Professor Statt says the bacteria commonly found in dental water are not dangerous for most people.
They're environmental bacteria. When we were kids, we ate mud pies, and these are the same organisms. But you shouldn't be exposed to these levels of bacteria when you're in a healthcare facility.
But it's not just an aesthetic problem. Some of the bacteria found in dental water can cause disease. The biggest risk is to people who are immune compromised. That includes many elderly people, diabetics, AIDS, and cancer patients. The risk also depends on what you're having done at the dentist's office.
Gum surgery, root canals, and tooth extractions are a greater potential risk because those procedures expose the bone beneath the gum line.
So if you had contaminated water, it would easily enter the bloodstream.
Absolutely. No question. Because it's open. It's an open wound. And that's bone. And that's why in medical surgery they never think of using anything but sterile saline or sterile water.
And having your teeth cleaned with an ultrasonic scaler can also be potentially risky because it gets below the gum line and flushes in water.
We've eliminated an ultrasonic scaler from our office over 8 years ago. I'd never go near it. I'd never have it used in my mouth.
It's what was used in Bea Foreman's mouth when in 1990 she and her husband went to their dentist in Pacifica, California to have their teeth cleaned. At the time, Bea was taking medication for a blood disorder, putting her in the high-risk group.
Do you remember getting your teeth cleaned?
I do.
Okay.
And leaving and feeling fine, you know, and then it all started, I guess, working on me.
2 weeks after the cleaning, Bea was rushed to the hospital where tests revealed a brain abscess requiring surgery.
They asked whether or not we had been to the dentist. And, of course, the answer was, well, yes, within the past 2 weeks we had been to the dentist.
Did you wonder why the doctor asked
sure.
if you'd been to the dentist?
Oh, sure.
It turns out that doctors identified bacteria in her brain that have been detected in dental water lines. She sued her dentist, who settled out of court denying responsibility. Bea says she's never completely recovered from the surgery.
They thought it was best not to try and take all of the poison out of my brain because it was too delicate.
A British dental journal reported in 1987 on 2 other immune-compromised patients that were believed to have been infected by bacteria originating from the dental unit water supplies. And in a 1995 report, a California dentist died from Legionella bacteria, and researchers found it is likely the dental units were the source. However, microbiology professor John Molinari, a spokesman for the American Dental Association, is skeptical about those cases.
I believe that there is some question as to the source of the organisms, and they have not been linked to dental unit water lines unequivocally.
The ADA says there's no published evidence of a serious health risk.
Can you say for certain that people are not getting sick from the bacteria that's found in dental water?
For healthy people, I do not have any concern.
But dentist Dr. Don Mazurlian was relatively healthy with no known diseases when he developed pneumonia.
How sick were you?
I think I could have died.
Dentists can be exposed to waterline bacteria from the mist that comes from the tools. So when he got out of the hospital, Dr. Mazurlian had his dental unit water tested, and they found high levels of the most pathogenic Legionella, which can cause pneumonia.
What we hear is that, yes, the dental lines are contaminated, but unless you have a problem with your immune system, you're not going to get sick. But you didn't have a problem with your immune system, and you got sick.
But my resistance was very low. I mean, I wasn't feeling very well. I was exhausted.
Could that make somebody more susceptible to this bacteria being run down, tired, stressed?
If a person is run down, tired, stressed, in sense they are immune compromised, even for a short period of time.
But he added,
I don't believe there's any evidence to suggest an increased infection risk in those types of individuals.
But even without those people, up to 10% of the population may be immune compromised.
You're talking now about millions and millions of people who could be possibly at risk from the dental water.
That is why the ADA took the leadership role to set a goal and to instruct manufacturers to address it by the year 2000.
And in the last few years, dental equipment manufacturers have come up with a number of solutions to the problem of dirty dental water.
This typical thing that you've had in your dental office where they squirt water in your mouth, we don't use all this in this tubing. This is what we use. That's all.
And Dr. Marijan uses sterile tubing and disposable bags of sterile saline for his dental tools. And there have been improvements in ultrasonic scalers where they too can deliver sterile water. Also on the market are waterline filters which trap bacteria and chemical treatment systems to flush out the lines. That's what Dr. Mazurlian now uses.
How long do you think it'll take before the water in most dentists' offices at least meets drinking water standards?
I think that within the next couple of years, you're going to see major moves in this.
Fender back here.
So the next time you sit in the dentist's chair, you may want to ask what, if anything, they're doing to clean their water line.
I would hope that maybe it would never happen to anybody else, but if it happened to me, surely it has happened to others, and maybe they weren't so lucky.
Arnold, so you say to your dentist, what are you doing to clean up your water line? And he says, don't worry.
Well, you may want to ask, let me see the results of testing, because they should be testing to see whether what they're doing is actually effective.
And they'll show you tests?
Well, they should be. If they're doing it and they're not afraid of the results, why not?
Why aren't more people sick?
Well, some people believe more people are getting sick, but establishing the link is difficult. If you go to the doctor, you're not feeling well, the chances are he's not going to say, have you been to the dentist lately?
And is this most dentists?
According to our test, the vast majority of dental lines are loaded with bacteria in the water.
This is shocking. I'm sure everybody who sees this is going to be talking about this tomorrow. Thank you, Arnold.
Okay.